Hi everybody, so we'll be talking today about A beta lipoproteinemias. A beta lipoproteinemias. Now, what is exactly the problem here? Let's try and understand the problem of A beta lipoproteinemia while we lose another $500 on trading. So what you need to understand here is that this is an autosomal recessive condition. Keep in mind, most of the biochemical disorders are in fact autosomal recessive. So if you have to take a wise guess, it's going to be an autosomal recessive condition always when you are talking about autosomal disease, these biochemical diseases. Now, what happens in the pathophysiology of A beta lipoproteinemia? Let's try and get the gist of it. So the thing is, blood in our body needs to be transported in a particular medium. Fats in a body need to be transported in a particular way in the body, because fat is not like other biochemical substances like carbohydrates, proteins. Fats is non-polar, whereas blood is a polar substance. So blood cannot carry fats in it because fats is non-polar while blood is polar. So what the body does is, if this is a molecule of fat, let's say, what the body does is body covers this particular fat molecule with some protein around it, so that this substance is now easily plausible to travel in the blood, because it acts like a polar substance. So this is called lipoprotein. Why do we call it lipoprotein? Because you have lipid inside and you have protein outside, so it's called lipoprotein. So what the body does in fact is that body covers the lipids, sheets around protein around it, so that it's easy for it to travel across the blood. Now the problem in A beta. Now one more question I need to tell one more point I need to tell you here is that the proteins that cover these fat molecules, we have two of them. One from the intestine, which is B48, and one from the liver, which is called B100. So these are the two molecules. That is APO. You have to add APO here. So APO B48 and APO B100. So these are the molecules, the proteins that cover the fat molecules. So this is for the endogenous fat. You must know there are two types of fats in the body. One you have is endogenous fat. This is for the exogenous fat, the fat from the outside, and this is for the endogenous fat, the fat from the inside of the body, the one that liver produces. So this is the endogenous fats. So till now the story is that you have to have fats covering proteins, or proteins covering fats, and they can travel in blood. Now the problem in A beta lipoproteinemias is there is a protein which is called MTP, which is microsomal transfer proteins, and these proteins are the ones that help actually in the production of those ApoB48 and ApoB100. Now since MTP is not being produced, ApoB48 is not being produced, ApoB100 is not being produced. So this is a lipid molecule. It's not being covered by protein, due to which it is not able to get inside. The body cannot dump it into the blood because it's a non-polar substance. It's simply lipid. Now, because of this reason, whatever fats you're eating up, whatever fats you gobble up, that tends to accumulate in the enterocytes, in the cells of the intestines, but it cannot be dumped into the blood because there's no protein to cover that. And that is the reason you see such kind of picture when you look at the histology of the intestines. These are lipid laden enterocytes. So these cells have been filled with lipids because these lipids cannot be spilled into the blood further, so they're trapped here. If you can, all these white things, they're fat molecules. Moving forward, you also have this problem of acanthocytosis in A beta lipoproteinemia. Acanthocytosis, as you have these thorn-like projections coming out from RBCs. Why do we have these? We're not really clear about this, but we do have it. This is important. Now, why do we have it exactly? Is because of the vitamin E deficiency, which we'll read about in just a while. So we need to understand that there are some things which are called vitamin vitamins that are fat soluble. So these fat soluble vitamins are A, D, E, and K, and out of these, E becomes extremely deficient because this is very much already less in amount in the body, and if you eat it less, it becomes further less. So there's a deficiency of vitamin E in this patient, and that will result into certain manifestations. So now let's talk about the clinical features of this patient. The clinical features will be he's not able to digest fats, so he'll have fat indigestion, which basically means, I'm sorry, not fat indigestion, it's fat malabsorption. He's not able to absorb the fats, because of which he'll have steatorrhea. He'll have failure to thrive. Moving further, the patient also has vitamin E, in very deficient amount. Obviously, all the 4 vitamins will be less in amount, but especially they talk about vitamin E. We're not really clear why, particularly vitamin E, but vitamin E seems to get affected the most earliest. Now, the symptoms of vitamin E deficiency include things like spinocerebellar degeneration. Then you have progressive ataxia, and the last one is acanthocytosis, as you saw in that picture. Intestinal biopsy will show these lipid-laden these enterocytes. I'm so sorry. So lipid-laden enterocytes are seen. These are those enterocytes that you see. Now coming to the treatment part of this particular patient, what you can do is see he's having a problem with fat absorption, so you restrict fat. So you restrict the long-chain fatty acids. Plus he's having vitamin E deficiency, so you give the patient large doses. Remember, you give the patient large doses of vitamin E. And that sums up Abetalipoproteinemias. A mouthful, but an easy one. Thank you.